Oh, awesome. Good afternoon, everyone. I was lucky enough to do my practicum with the Heart and Stroke Foundation. So if you can't tell, it's heart and stroke. I personally, it took me a week to actually realize what it was. I was like, what's this symbol? And I think it's a great representation, a good visualization of the Heart and Stroke Foundation. So I just wanted to start off a little bit with some really interesting stats that really got to me when I first got working for the foundation. You know, knowing that one person in Canada dies every 5 minutes from a heart, brain, or stroke or vascular cognitive impairment, which works out to be 1 out of every 3 deaths in Canada. And that to me is shocking. You know, that means that one of us, a good portion of us in this room today are probably going to die of one, could potentially die of one of these conditions. Vascular cognitive impairment is a new term that the Heart and Stroke Foundation kind of put forth this year. It's to focus on like dementia-related conditions, and that isn't just Alzheimer's, it's all types of dementias. And when you have a stroke, it's going to affect a part of your brain, and that's going to be something that's going to potentially impact your cognitive impairment. So that's why they want to make sure we have that focus in there. So 5,000 people die of heart failure each year, and there are about 600,000 people in Canada living with heart failure, and there's 50,000 cases diagnosed every year. These are shocking numbers if you ask me. Those with heart failure have triple the rate of stroke, and Indigenous women unfortunately have a 53% higher risk of coronary artery disease than non-Indigenous women. 62,000 strokes occur in Canada each year, and 45% more women die of stroke than men. And this could potentially be because women live longer, but you know, these are to me shocking, and 80% of them can be prevented through healthy habits. So while in my practicum, I was lucky enough to provide some health education to different groups. These are just some of the ones that I did. And each presentation that I did kind of had a different focus on it. I actually went from oldest group presentation group to youngest presentation group, and it just so happened that it went that way. The Hamilton Seniors Day group was mainly Italians, and so I had someone who was translating it with my presentation alongside me. My Catholic Women's League's presentation in Winona was, focused a lot on the women's issues. And women, it was a big feature of the Heart and Stroke Foundation back in last year, where they really recognized that women are underdiagnosed, under-researched, and their symptoms go unrecognized. Women, it's a generalization, but we kind of, just let those pains and symptoms go by. But we need to remember that sometimes those could be signs and symptoms of something worse. The McMaster University Cardiac Care Club Conference was for predominantly about second year, third year life sciences students who have a real interest in cardiac. And it was really interesting to follow 2 doctors who talked a little bit about what they do in cardiology, and then for me to come up and then talk about how you could avoid going to see those doctors. So that was kind of interesting to do. And then the March Breaks Kids Club Camp was a presentation I did for I think there was about 30 kids there, and it was ages 6 to 12. So I adapted a jump rope for heart presentation and focused it a little bit on how some easy healthy habits they could take forward going forward. I attended health fairs at the Seaway Mall in Welland, as well as at the Ford Assembly Plant, which for me as a partial car person was very interesting because I was able to walk across the assembly line and see all the cars being made, but then also to talk to the assembly workers just a little bit about their heart and stroke risks. And it's just amazing. They had at the Ford plant 5 people die in a span of about a month of heart conditions. And so they really wanted the Heart and Stroke Foundation to come and just talk a little bit about how they can reduce their risks. And unfortunately, I was supposed to attend a radio presentation at the Six Nations First Nation, which is just outside of Hamilton. But unfortunately, we had a horrible winter in Hamilton, and so unfortunately, I couldn't attend that because of the snow. So as I said, my health education focused on a bunch of different things. We've some of them focused on the signs and symptoms of heart attack and stroke. Some things we also talked about were some of the risk factors that you could have to heart and stroke diseases, so things that were unavoidable. So your age, your sex, so women are at higher risk, your family or medical history, whether or not you're South Asian or African, and if you're Indigenous. These are all things that are going to make you at risk for heart disease and stroke. Some conditions that are, going to put you at risk are, high blood pressure, high cholesterol, diabetes, atrial fibrillation, and then the modifiable ones. So having a healthy weight, eating a healthy diet, being physically active, not smoking, reducing your stress, and reducing and limiting your alcohol and drug abuse. The other parts of my presentation, which was my McMaster presentation, I focused a lot about how to make those lifestyle changes. So I really focused on, how you could address the modifiable risk factors. So how can you apply the Canada's Food Guide? So the Heart and Stroke Foundation was really helpful in creating the new Canada Food Guide. And we did setting SMART goals, so those goals that are specific, measurable, attainable, realistic, and timely, and then also suggesting to learn CPR. All right, so I really focused on looking at an evaluation for my practicum project on the Jump Rope for Heart program. The Jump Rope for Heart program has been around for 37 years, so I'm guessing most people in this room have heard about the Jump Rope for Heart program. In 2019, the program is hoping to reach 4,000 schools and have 1 million kids jumping. It's primarily a fundraising program and encourages physical activity. But part of the program is to also include some health education aspects to it. So we teach the FAST, as you can see up on the top there, which talks about the different types of stroke systems. And then we also talk about the easy, healthy habits. So if you can see there, the easy, it's pretty easy. It's eat fruit and vegetables. It's be active. So it's that working on the activity aspect of encouraging children to be active for greater than 60 minutes a day, limiting screen time to less than 2 hours, so working on the sedentary guidelines, and choosing water over sugary drinks. So when I focused on the evaluation, part of the reason why it's not done at present is that it's not a priority for the foundation. There's really not any money to evaluate. Their outcomes are hard to measure, and they really look at it when they do any type of evaluation is looking at it within a fundraising lens. They try to maximize participation. How can we get more schools involved? How can we get more kids involved? How can we raise more money? That is where they're confirmed. But they do, when they look past a little bit of that, and they look to the stories of impact. And that's why I've included this picture of Max. And I encourage you to look up, on YouTube, Jump Rope for Heart Saves Lives, Max's story. Because Max is a great man. He had his Jump Rope for Heart assembly, he saved his dad's life because of what he was taught at his Jump Rope for Heart. So I encourage you to check that out. So I applied an evaluation framework and used the CDC program evaluation framework and looked at the health outcomes, including addressing the healthy behavior, so physical activity, healthy eating, screen time, and sugary beverages intake, and whether or not they were aware later on of the signs and symptoms of a stroke, so the FAST. Looking at the resources potentially of that the heart and stroke employees provide, and whether or not the program is effective in general. So the reason why we think you should evaluate health fundraising programs is that it's important to provide evidence of the positive impact of the dollars donated. Research has shown that actually, if you do evaluations, you could actually increase your donor dollars. It also helps to increase staff and volunteer morale, and it shows that there's a shared purpose. The evaluation can also help to engage stakeholders and increase the awareness of impact. So I think it's really important that programs look at, looking past the fundraising aspect of it and look to how they're impacting their health. Just wanted to thank you guys very much. Wanted to send a special thank you to the Heart and Stroke staff at the Hamilton office, including Donna, Paulette, Alex, Brigitte, Melissa, Syra, and Sabina, the staff here at UVic, and my family and friends for their support for me finishing my program. So thank you very much, everyone.
Thank you, Stephanie. I'm surprised you didn't ask us all to do a 5-minute Stretch.
Very tempted, very tempted.
So
you know, when I talk about the fast symbols, reaching your arms up above your head and stuff like that, the good exercises, and in our presentations, we get the kids to get your heart moving and jumping, so we should have started off that way. You're right, Nigel.
I'm hoping for questions from right around the room, so at least I get some exercise. So someone right over in that corner, do you have a question? Any questions? There we go. Good. That's a good distance. Yeah. I don't know if I can. There we go.
Great presentation. You briefly mentioned about the new Canada Food Guide and everything like that. So I was just curious. I know that it wasn't necessarily the focus of your work, but what are the implications of the new food guide when it comes to the Heart and Stroke Foundation and their messaging?
So the Heart and Stroke Foundation was one of the scientific backers of the new food guide. Actually, their CEO was with the Health Canada health minister when they released the new food guide. So it is quite evident, and actually in resources from the Heart and Stroke Foundation, even before the new food guide was released, the symbols were placed within the thing. The foundation actually lost money and funding dollars from the dairy farmers of Canada because they chose water over sugary drinks, including milk. So there is some fairly large implications, but it's important because if we live the food guide, we're going to be creating some healthy habits that encourage eating those fruits and vegetables, and also, creating a healthy weight, which is one of those risk factors that you have for heart disease and stroke.
Any more questions? Oh, yes.
The indicators for stroke are different for women and men.
Yes.
So I was just curious if you're aware of any social media campaigns to get the knowledge out about what those indicators are, because the research is based on men currently.
And that's true, and that's part of the work that the Heart and Stroke Foundation is working on, because they realize that men and women, it is different. 2/3 of heart and stroke research is presently done on men, and we can even tell in this room is mainly women, and so you can't be doing research just on men. You need to be doing it on women. I know that my personal social media, I know that they're really focusing on FAST for stroke messaging, because those are the main common signs that you can see, and it applies broadly to all populations, not just women. I think there's more of a difference between the heart attack symptoms for women than it is for men, because for some women, they may not even experience the crushing chest pain that is typical in a heart attack. They may just be experiencing nausea or hot sweats and that sort of thing. So, yeah.
I've got one question, and it sort of relates to the sort of almost sustainability of sort of commitment to a change in lifestyle. And we all know of people who, including myself, who buy the membership to a gym club at the beginning of the year, and 3 weeks later, it kind of, one's interest wanes. So what's the biggest barrier in terms of getting a sort of a longer term commitment to a healthier lifestyle?
I think it's more so it's making sure that when you set a goal for yourself, and making it be a SMART goal. So making it be something that is specific, something that is measurable, something that is attainable, something that is realistic, something that is timely. So if it's, I've gotten this gym membership, it's been 3 months. Why is it that I originally wanted to do that gym membership? Why did I want to do that? And it's finding those goals and looking to a support person to help you to achieve those goals, and having those people around you to try to make those goals best as possible.
Okay, good. Thank you very much. Thank you very much.
Thank you.
Excellent.